this was a randomized phase 2 trial. We aimed to accrue a total of 72 patients. It was a non-comparison trial, so there was predefined statistical endpoints for each arm. And one of the arms was Everolimus Letrozole, the other arm was the medroxyprogesterone tamoxifen. We accrued 74 patients. It's interesting, we accrued 4 months earlier than our target accrual date. So one of the conclusions we found is that we desperately need endometrial cancer trials, and we're able to accrue in a timely fashion. What we found is that the response rates of the Everolimus Letrozole was comparable when compared to the hormonal therapy. Actually, the progression-free survival was appeared to be more favorable, a longer progression-free survival than traditional hormonal therapy. When we looked at the population of patients who had no prior chemotherapy, we found a response rate of 53% of Everolimus Letrozole. Now that compares favorably to the best chemotherapy trials that we have. The duration of response to the progression-free survival in those patients with no prior chemotherapy who received Everolimus Letrozole was over 21 months. And that's actually much higher than anything we've ever seen with chemotherapies. So while it is tough and hazardous to do cross-trial comparisons comparing outcomes of this study versus some of the chemotherapy trials, it is safe to say that the numbers look favorable, and it's definitely worth further investigation to determine whether or not Everolimus and Letrozole, or targeting the mTOR pathway and the hormonal pathway, can actually become the standard of care for this disease.